Let's Cover That podcast is brought to you by CM&F Group, professional liability services for over 200 healthcare professions. Visit our website at cmfgroup.com/podcast for more info.
Hey everyone, Will Sullivan here with Let's Cover That, one of your co-hosts. Today we have Antonina taking a bit of a sabbatical, so it'll just be me solo, rolling with it. We always focus on healthcare entrepreneurs that are filling gaps within the healthcare industry. So today we get to actually go to who's pushed the podcast with us at CMF Group, Jared Taylor. Jared, awesome having you on officially here rather than on the back end. Can you tell us a little bit about yourself and get into your work at BlocHealth?
Yeah, so excited to join you, Will, and I'm so excited that we put this podcast together. I'm excited to see how we continue to grow it. But you and Antonina are awesome. Yes, I'm Jared Taylor. So my background was I worked in healthcare staffing for a few years, and then realized the gap in the market. Ended up trying to start a healthcare staffing marketplace after leaving my previous job called BlocHealth. So BlocHealth was the name of the company, but realized after a while that the bigger need was actually the licensing credentialing. It didn't matter how quickly you could place someone. If you couldn't get them licensed and credentialed in a timely manner, then it was all for nothing. So it was at that point basically that we ended up going to pivot after about a year and a half to licensing and credentialing. And it really made a ton of sense for us. As you know, those are two huge pain points. And we did a lot of research, and we launched that piece of the platform a month before the pandemic, when all these virtual care companies are like, I need to get licensed, and I need to get set up with the payers in all these states. So it worked out, and that kind of brings us, to where BlocHealth is today.
Yeah, so when you're talking about credentialing and licensing, I mean, number one, what are the providers you guys are working with specifically? It's just like across the board, like doctors, different nurses. Who are you guys kind of operating with, start to finish, now that you're here?
Primarily virtual care companies. Okay. And that was just a result of the pandemic, right? Before we launched, we thought it was going to be like private practice, urgent care centers, just the nature of who needed these types of services. But then what was crazy is these companies went from, and these clinicians went from needing maybe 2 licenses max to 20 being like the new average, 20, 30 licenses so they could see as many patients across, state lines. But yeah, so virtual care companies, we work with urgent care as well, some private practice, and then we have some partnerships with some of the membership associations.
Cool. To step in a little bit on the pain point of credentialing and licensing, like you mentioned, it's not a successfully, set up process for this. And it really, not only does it hamper access to these providers, but it hampers just the business of getting up and running and making revenue to open your doors too, right? What's the timeline look on the average credentialing or licensing, getting that information in and out to payers and setting up versus kind of like where BlocHealth differentiates and expedites that, just, to level set?
Yeah. So I hate saying this term, but I'm going to say it anyhow. It depends. It depends on numerous factors, right? It depends on the healthcare professional that we're working with, whatever that type is. We work with about anywhere from 6 to 10 different types of healthcare professionals, so it can differ greatly across those different professional types. But like our bread and butter is physicians, advanced practitioners, therapists, and we've done stuff with dietitians and some other healthcare professional types. But it really you have certain states that can be really long and drawn out, where it can be almost up to a 6-month process. And even if you can get your application out the door quickly, you have to, what's the phrase? The squeakiest wheel gets the grease. Yeah. So that's where we really focus in on, where in some of these states that take a while, like we have a great follow-up process and continuously stay on top of the licensing boards to get in front of them. Just let them know that, hey, we have a request here. But and then in terms of like enrollment and things so anywhere I would say it depends on the state. We've gotten people licensed in as quick as a couple weeks, and in some states it can take a couple months still, even if we do the best job possible. And then in terms of enrollment, similar, you're looking at anywhere from like, 90 to 120 days is very normal. And what we're looking at is how do we shed off minutes, and those minutes add up over time on each application. So it comes down to data collection, but also I'd say the biggest superpower companies can have in this space is actually just the expertise, the knowledge base. We've been around since 2017. There's been companies that have been around for a while, but in this new pool of companies that are coming into the space, we've been around the longest. So you have all this data built up around how long it takes for the state, who the contacts are with the states, what don't they like, what do they like, and that's the type of data that we're looking to continue to, put action to, so that we can continue to streamline the process.
So yeah, and that's great because it speaks to where you guys are at now. So you just have the recent transaction that's hit with SteadyMD. So why don't you kind of like walk us through, clearly somebody that's kind of like within the purview of what you talked about as you enter COVID, where the virtual care atmosphere is really like building up, and now you're joining up with one. When that happened, how's that kind of courting process and where you guys are now?
Yeah, so it happened a while ago. It actually, the CEO and the CEO, Guy Friedman, I had him on the podcast in the early days, about 2 years back. And that's when him and I started building the relationship, and then I saw him at some events. So, the podcast is great for building relationships, and when you continue to stay in touch and you learn about the other person, good things can happen. It just felt like the perfect match, honestly. When I first started BlocHealth, I wanted to create the end-to-end solution. We staff the program, we license the clinicians, we get them set up with the insurance payers, and then we kind of manage the compliance piece. And then this acquisition came about. We staff the organizations, we license them, we get them set up with the insurance companies. So it is the vision that we had from day one. It's that's what ended up happening. But so together we can provide this end-to-end solution that doesn't exist on the market, and we are so excited. And as you know, Will, I talk with so many companies through these podcasts and everything. So when I like a company, there's a lot of reasons behind it. So I'm ecstatic for what this means for BlocHealth and SteadyMD and the future of the licensing credentialing industry.
Awesome. What's as you look forward with the work with SteadyMD and BlocHealth now being part of the family, what's the new venture that you guys are going to kind of disrupt and provide the patient access and, kind of getting that rolling? Like what's the big item, big ticket on the horizon that you guys are seeing?
Yeah. So, I mean, the biggest thing is we've known each other for a while, but continuing to get to know each other and to make this as seamless as possible. We are still an independent. We still operate separately from SteadyMD, but there will be collaboration points, right? Synergies that make sense across the two organizations. Really, what we're working on is creating the best end-to-end, experience for both the clinician and the administrators at the organizations that employ or contract them. That's really, and that comes down to the data entry. So data import, data export, that's where we're really focused in on, is how do we make that, as absolute seamless as possible, is really our biggest concern.
Yeah. Do you find when, especially with your background in staffing, when you're trying to get things in the technological landscape, how do those companies respond to something like BlocHealth, or, do they want to embrace it? Do they have, once you build out a technology that kind of makes a leap like you guys do, sometimes it's hard to get people to buy in because they just don't have the aptitude for it yet. How does that, in the staffing industry, it's just such a clunky industry. You have people in and out. It's blown up completely. We'll kind of see how does that ratchet back or not as, governmental support, COVID going in and out, like what that long game looks like. How's that how's the response been from the administrators and taking that in and making this part of like a growth plan, leveraging you?
It's been a good like the conversations have been really great. Now, not with everyone, right? Like some people will never get it, and that is totally fine. But I would say the majority do. There's so when you think of like a healthcare administrator and a clinician, you think of how much they have to do on a daily basis, and when you add the licensing and credentialing and then also staffing out the program, that can take the majority of their time, where they could be focusing on other areas of their business that maybe they should be focusing in on. So outsourcing or partnering to have, like, we view ourselves as an extension of their team, right? And they can take us or leave. They could decide to use us for everything or just use us for parts of their process, and we're fine with either. It's just it's actually, I think, having the right conversations around this. We're not pushy. We just want to tell people what we're doing, have them understand that, and then if there's an opportunity to work together, we do. But we feel really good about just how people are understanding everything and wanting to work together.
Yeah. Well, I think it's interesting from our perspective on with our company, our background, the CMF group, because our goal is to do the little piece that we can do to help the country's healthcare system, which is, listen, you need protection. You need to be able to have coverage when you step in front of a licensing board. You need that personal asset coverage. Trying to make the process seamless and simple for people just eliminates the administrative hassle personally or for an organization, and kind of gets people kind of foot forward on quality of care treatment rather than focusing on the administrative hassle of making sure somebody can actually go in front of the patient. And it almost seems like, BlocHealth is in alignment with the same type of collaborative. You're doing this one piece that just gets people out the door to be accessible to clients, patients. It's kind of the synergy that I see, our company, what BlocHealth does, and then, the benefit that it really provides to the marketplace through SteadyMD too, which is really exciting.
Yeah, you're 100% right. I really think it was a match, just a perfect match on both ends. And the fact that I will tell you this, I've been around a lot of teams. I've never felt more comfortable around a team than their team. I felt like I've known these people for years. Their leadership team is exceptional, so kind, and really understand the space well and what it takes to win in this space. And I don't think any of us have any doubts that we are going to win in this space, because it's a team of executors. And, executors will always outduel all flash and no execution.
Yeah. No, I think it's, people say being partial to action is a big way to win. And it sounds like a team of executors is really good. Final thoughts, Jared, to close this up?
Just really excited, super excited to be on your show. It's I always listen to it, but the fact that I get to be on it, that's a win. And I look forward to, with you, future episodes and who you have. I have the privilege of knowing who's coming up too. So everyone get ready, and everyone should give you a huge shout out, because doing this on your own without Antonina, without your other half. It's a different ball game, and you killed it. It was great. Hopefully, two bald guys with beards don't overwhelm the audience. I think that's another reason we have Antonina's here. So when it's you and I talking, we have someone else that they can listen to as well.
It's a bit of a there's a lack of counterbalance, even though I'm the bald bearded guy from New York who's Irish, and you're the bald bearded guy who's Italian and Irish from Boston. So it's, and the headsets match too. So it's, no, Jared, it's a pleasure to have you on another episode. Let's cover that, which is, the incredible work that you're doing. I'm excited to see what SteadyMD does. It's amazing good work that they're doing already, and it's just going to continue to put fuel on the fire with you guys. So congrats on that. And that's another episode, guys. Thanks so much.
Thanks, Will.